everybody's going to be insured, but there's no doctors taking the insurance.
For residents in rural areas, difficulty finding a physician that will accept Medicare or Medicaid is becoming more difficult.
Your rural areas, you are typically going to have more elderly, more children, and more disabled people. And those are going to be the people without health insurance.
Populations that have more Medicare in them, like your small towns, your rural areas, are going to be extremely hard hit.
As doctors are receiving fewer reimbursements for accepting Medicare and Medicaid patients, a decline in rural medicine is confronting small-town residents.
It's difficult to be a small-town doctor, and you definitely will make more money as a physician if you go into a bigger town.
That's why more and more of them are getting out as a business, and in a rural area it's hard to find people that want to come.
The individuals out in those in the rural areas have less health care providers to see them. So there's a shortage of physicians in the rural areas.
This shortage is caused by the inability of public hospitals and health care centers to provide financial incentives to medical school graduates.
Access is going to be harder to get to because there's not going to be the people out there that want to do it. The smartest kid on the block isn't going to want to go into medicine anymore. The money's just not going to be there for them.
The inability to find a physician that will accept Medicare or Medicaid isn't the only concern. The quality of health care is also at risk.
It's going to scale down what they can and can't do, and it's going to scale down the time that they take with the patient because there's going to be less and less doctors, there's no doubt. Is this going to give better access to the people that didn't have insurance before to the medical field? And the answer to that is clearly no.
If you can have everybody insured but nobody takes the insurance plan, then what's the point?
Andrea Flores, Pro News 7.